Good day everyone. The FMS department proudly presents one of the CBAHI standard, the Hazardous Materials and Safety Datasheet, previously called as Material Safety Datasheet. FMS 14, the hospital ensures safe management of hazardous materials. FMS 14.1, there is a written hazardous materials plan that includes the following. FMS 14.1.1, appropriate handling, storing, transporting, and disposing of hazardous materials. FMS 14.1.2, education and training on signs and symptoms of exposure to hazardous materials and the appropriate treatment according to material safety datasheets, or presently called safety datasheet. Hazardous material storage is very important. The staff that will deal to any hazardous material must read the label carefully and the safety datasheet of the chemical you are dealing, that is available in the safety datasheet folder and in the hospital data. The staff should know at what temperature this material must be stored, if this material be reactive if stored near other chemicals, if the material is stored in its original container, and if it is labeled properly. Handling of hazardous materials must take in special precautions when pouring, transporting, or in any way handling hazardous. Again, read the label and safety datasheet. The staff should know how to prevent spills, if the material reactive and if will sudden movement affect it. Disposal of hazardous materials must be done carefully. Again, read the label and safety datasheet. The staff should know if the material can be poured down in the drain and if it will be disposed with a specially marked container. Overexposure to hazardous materials could be with mild or severe symptoms. Symptoms may appear as a result of long-term exposure, or they may appear very suddenly. Be aware of the symptoms of overexposure to materials at your work area. The staff dealing with chemical must read the label and safety datasheet. For overexposure, the staff dealing with hazardous materials should ask her or himself the symptoms of overexposure, assess for dizziness, headache, if rashes was developed, or if eyes are burning. The staff must know the locations of eye wash station and emergency shower. Let's proceed to FMS 14.2. Each department has a current list of hazardous materials used in the department, and the list covers the purpose of use, the responsible person, and the permitted quantity. In King Salman Hospital, we are using this hazardous materials list with weekly monitoring. There is an assigned staff that was trained to perform the inventory or monitoring of the available hazardous materials in the department. The inventory should be done every Sunday or as needed. The said hazmat list on present month must be fixed outside hazmat storage cabinet. After every month, the completed hazmat list must be attached in the safety datasheet folder. FMS 14.3, the department dealing with hazardous materials has safety datasheet relevant to its current list of hazardous materials that should be available inside the safety datasheet folder of each department. FMS 14.4, each department dealing with hazardous materials has proper personal protective equipment or PPE and spill kits to handle any spill or exposure. FMS 14.5, all hazardous materials are labeled clearly, and this includes anti-neoplastic drugs, radioactive material, corrosives, acids and toxic materials, hazardous gases and vapors, anesthetic gases or flammable liquids. FMS 14.6, any leak, spill, or exposure to any hazardous material is reported. This is a sample of housekeeping trolley hazardous material list with weekly inventory. Safety datasheet contains all the important information about the chemical, and the most important are the product identification, hazards identification, uses of chemicals, first aid measures, accidental release measures, spill management, handling and storage. Most of all, always refer to safety datasheet in your unit if you are dealing with hazardous materials. This is the MSDS folder looks like in your department. To access the safety datasheet in the hospital data, kindly follow this procedure. Open the hospital data in your department's desktop, go to Facility, Management and Safety folder, open the FMS Policy and Procedure, then to Safety folder, and finally you reach the safety datasheet. The FMS team is hoping that this educational video will be helpful for the staff awareness purposes regarding hazardous materials and the safety datasheet. Always remember that our safety lays in our hands. Be aware, be safe. Thank you all.